The approach, again, this is kind of the key. This is where you're telling them what you're going to do, and that's why this is important. So for each aim is going to have a little brief introductory. Why is this aim important? It's going to say what the design is. What are you going to do? It's going to have something on the expected outcomes. What do you think is going to happen? And you're also going to conclude each one with a little section on potential problems and alternatives. And I'm going to go through each one of these. You want to end the approach with a timeline. And sometimes the timeline can include the benchmarks. Sometimes the benchmarks should go in with each aim. I like to put them in both places. And by benchmarks, again, is what do you expect to happen? I expect a 20% increase in diagnostic accuracy, whatever. And then at the end, a little future discussions. And think of this as a good book, as a story. You want to grab the reviewer's attention and keep it. You want each aim to logically flow from one to the next. A killer review is going to say, if aim 1 fails, the rest of the grant is shot. Or aim 3 really is not connected in the least to aims 1 and 2. Let's cut aim 3. I would fund this, but let's remove 2 years because they don't need aim 3. You've got to think about the logic from aim to aim to aim. Make it flow. Again, it's a story. Think of it that way. Introduction, plot, denouement. You know, back to English or literature, whatever that course was we all took. So, how to develop each aim. Again, it's all about flow. So you're going to have, again, a little bit of introductory paragraph, a brief overview of what this aim is about. Hook 'em, okay? Restate your aim objective. Again, you've got an overall aim for your entire project, but each little aim has a specific objective. What's the point of this aim? Also state the hypotheses. And I like actually breaking out, and not in the text, but and you'll see in a second, a specific little statement that's saying, this is my hypothesis, this is what we're after. Very briefly describe the approach, your methods, really, and the rationale for those methods. Why are you using this reconstruction method versus that one? Okay? Is filtered back projection good enough? Or why are you using this technique? Was it validated? Okay, so on. And then again, your expected outcomes. And this is usually, that little introductory right all there, is about 1 paragraph, quarter to a third of a page. That's kind of your very brief introduction. Okay? This is just an example. Our overall hypothesis, and then I specifically went through and described aim 1 will do this, aims 2 and 3 will do this, and highlighted what I'm after, accuracy and efficacy. And I put that right before all of my aims. That's the beginning of my research plan to some extent. Here, very nicely in a nutshell, what am I doing? What am I studying? What are my techniques? I'm going to be using ROC, and I highlight the team there as well. So if you've got an interdisciplinary team, or you've got, you know, high-powered figures, tell them somewhere in the proposal who your team is. Don't just rely on them going and looking at all the bio sketches. As often as possible, I like in the text to note who's doing what. This is especially important if you're doing subcontracts and stuff and you've got multiple aims. Within there, simply say, you know, the lead on this aim is Dr. Smith. The lead on aim 3 is Dr. Jones. And that helps justify why you've got all these multidisciplinary people. It helps justify when, you know, where's your clinician coming into place? Where's your physicist coming in? Where's, you know, you got an ophthalmologist? Where's your statistician? Do you have a pathologist? So throughout, try to know who's doing what and where. And then this is my introduction to an aim. Okay, so that the previous paragraph, there was an overall, here's what the rest of my proposal is about. Now here's one of my aims. And again, this is about a third of a page, half a page. Boom, here's my aim. And that aim I've stated on my specific aims page, and this is the exact same wording. I'm repeating it again. And then, again, I give a brief paragraph. Why is this important? Why do I want to know about this? I've added some references for scientific background, and I've highlighted down at the bottom with underlining what sort of this is we expect to happen. Thus, we would expect fatigue to exacerbate these areas. And then, boom, I state 4 hypotheses that we're going to address. And each of those hypotheses is stated in such a way that it accents what my expected outcomes are. Detection accuracy and complex image interpretation tasks requiring more than one target will decrease as a result of. So I've got my hypothesis plus my expected outcomes. When you get into the redesign, these are the methods. And again, this goes with each aim. What the NIH and everybody else is looking for is a rigorous experimental design that will produce robust and unbiased results. That's straight from the NIH. Okay. They are no longer funding just, oh, whatever. You know, they used to fund just about anything. When the competition wasn't so great, they would fund armchair science. I mean, they would have funded Einstein to sit there in the patent office and just think. They would not fund Einstein anymore. I don't think anybody would. But what are they looking for? Replicable. So enough data there to show that somebody else could go out there and replicate. That it adheres to the principles of good laboratory practice as close as practically possible. Now, the good laboratory practice was originally developed for drug studies. But really, it talks about replicability and generalizability. Try to say that 10 times. Generalizability to all other research. And then there's, in your research, consideration of relevant biological variables. So talk about gender, minority, children. And although this is a special section in nearly every granting agency's requirements, and you're going to do it in your human subject section, you also want to talk about it here in your text. So, you know, I'm going to do a study, 30 subjects, as close to half male, female as possible. We are not including children. We are. And our local population is XXX in terms of different minorities. You want it to be meaningful, but not all the gory details, and you want it, again, to be logical and to flow. So what are you going to talk about? Your approach, an overview of the methods, potential sources of biological variation. Why are you using men versus women? Do you expect differences? If you've got agents, that's a new NIH thing, the agents and authentication. Talk about your major and minor equipment. We're going to do 70. Okay, who's 70? GE's? Siemens? Whose? You know, so what type of equipment? Number of animals and human subjects, how you got to those numbers, a little bit here, but also verified. Next week we'll talk about boilerplate, the human subject section, and so on. Talk about your statistical analyses. Are you doing t-tests? Are you doing ANOVAs? Talk about your controls, replications if needed. And again, what are your expectations and how are you going to interpret your results? And then time to complete all of these tasks. So again, it's hard to think that you can get all of that into about a page. So it is a bit of an art, and you got to, like I said, decide between, you know, what level. This is just a method section from one of mine. This goes with one of my aims. So what did I talk about? I talked about the images. I talked about the participants. I briefly described the methods, and then I talked about my analyses. And I went into enough detail that somebody could see exactly what I'm doing, but, you know, not so much. Okay, so again, it's a balance. So I strictly describe the types of cases. You know, if you're talking about, you know, patient studies, what are your acquisition? What sequences you're going to be doing? Is it contrast versus no contrast? You know, details like that. I specifically talked about my analyses. And then the methods, I kind of described what was typical for an observer performance study and so on. Sometimes it helps to include a figure, especially if you're doing something different, or if it's sometimes just a heck of a lot easier to explain things with a picture. So here what we were saying is we're going to record EEGs, And rather than go through a whole big description, because I'm also using a new piece of equipment here that most people in radiology may or not be aware of, I simply got a picture. And I said, here, this is what we're going to make them do. And I kind of showed that the system that we plan to use is not very invasive. It's simply this little helmet that they're going to wear. They're going to sit in front of a computer monitor like they would. And then it's pretty self-explanatory. And rather than spending, 5 paragraphs talking about the whole darn thing, it's right there. And then when they're looking at my budget justification and why I want this piece of equipment and what it is, they say, oh yeah, I remember seeing that picture. Oh, I see what it, oh yeah, I could maybe see that would be about $20,000. Yeah, okay, So it serves dual purpose. And again, I just put a little description of what it does, what it collects, and so on, without going into a whole lot of detail, but giving enough detail that shows I know what this system does and I know what I'm going to collect from it. Yeah. So again, how much detail? Has anybody on your team or anybody else, in a sense, published in a peer-reviewed article using these methods? If they have, reference it. Okay, don't go into all those gory details, especially if it's a standard technique. I have seen some proposals that go in and provide pages and pages of equations. And it's like, yeah, but you could have just referenced your previous article. Why'd you waste all your space showing me all these silly algorithms? Because most people just don't, to be perfectly honest, oh, there's an equation. They just don't even read it. So if you can, as much as possible, reference it, especially if it's somebody else's technique and it works and you think they're going to be on your committee. Then go ahead, reference them. Because sometimes it takes space to go into all these gory details, and to be perfectly honest, it can be quite boring. We use this reagent. We are going to use 60 milliliters of saline, and we are going to clean our beakers very carefully because they have to be clean. Everybody's, and just on and on and on. And it's like, okay, you're going to use good standard practice. Boom. I'm going to use the ELISA. Boom. We've done it. Okay. The point of the detail and how much you want to go to is basically, does your training make it obvious that you can do? So again, when you're writing your bio sketch, it allows you to go in and put, what's relevant to this. Put in the articles that show you can do X. Okay. And if you're a new investigator or an early stage, you might need a few more details here to convince the reviewers that, yeah, you do know what you're talking about. I'm a novice here. You don't know who I am. So I'm going to get a little bit more detail to show I know what I'm doing. Okay. Yeah.
What if you don't have a lot of experience doing whatever someone else on the team does? Can you combine?
Absolutely. And that's where you put in the names. Okay. So I'm not going to be in charge of this aim. Dr. Smith is. Okay. Or when the ROC, the development, our project involves some ROC, and this is kind of all the description. Kevin Burbaum, my co-PI, he's the expert there. So I said, the analyses are mostly going to be done by Dr. Burbaum. Boom. And so tell people that helps justify why you put them on your grant in the first place. Okay. And this is just a section. Now, a lot of people don't get ROC, especially some of the more advanced techniques. And so when we said we were going to do ROC, we were using specific versions. And so I went into a little bit of detail. And I kind of explained it, but I didn't provide any equations here. I didn't go in and say, well, the reason we're doing this is because da-da-da-da-da. And I had to get this paragraph. My co-PI on this is Kevin Burbaum from the University of Iowa, and they are the gurus in ROC analysis, and he had about a page and a half on this. And equations and this and that. I mean, it took me forever to get it down to a paragraph. But this paragraph really, with the references, explains exactly what we're going to do. I don't need to explain all the equations in ROC analysis. Boom, here, this is enough, okay? Because the reviewers could really care less. Expected outcomes, this is critical, okay? Basically, what are you going to do with that $1 million that you get? What are you giving back? What's their return on investment? Okay? So make it exciting. Make it relevant. Don't overstate. Again, you are not curing cancer. Okay? So be enthusiastic, but be realistic. And it helps sometimes to provide caveats. This is going to be good, but it's probably going to require more studies on a larger set of populations to truly validate. Okay? But we expect we're going to have great results. You're also going to want for each aim a statement of problems and alternatives. Okay? Because there is no such thing as no problems. Every grant proposal, no matter good you are, there's going to be bumps along the way. So you're going to want to include it for each aim. And the goal really is, again, to show the reviewers that you truly understand this field. You understand the challenges that you and everybody else have faced. And if X goes wrong, what are you going to do? So, for example, suppose you're working with a subcontract or a vendor, and that vendor is developing a new technology. Okay, some of the grants I've written in the past, we were working with monitor vendors, and they were developing new TFTs, the display panels. And the grant depended on, to some extent, the company developing and having the electronics that would make that TFT work. Well, we said, okay, you know, they're a high-profile company. It's AZO or Todeco or whoever we were using. But if they can't figure out how to make a 2-megapixel monitor into an 8-megapixel monitor and have the electronics work without too many dead pixels, we will use X. This is our backup. Subject recruitment. This is huge for clinical trials. We expect to get 50 patients because our clinic sees on average, you know, 2 patients a day, blah, blah, blah. In a year we should get this many. If we don't, if for some reason we can't recruit people, all of a sudden everybody's saying like, God, I'm not going to do that. Or what if we have too much of a dropout rate? What are you going to do? These are the types of questions that the reviewers are going to go through. And sometimes it helps, you know, and I said it, Trini said it, everybody said it, have somebody else read your proposal because they're going to see the gaps. Okay? And I usually try to recommend get somebody outside the field. Take it home to your significant other and say, please read this over and tell me if it makes sense. Do you understand what I'm saying? Would you be a subject in my study? Okay? And if they can go through it and understand, not all the details, but at a high level, what you're doing, then it kind of makes sense and you're probably going to be safe. This is just an example of my potential solutions. This was, I think, yeah, this was still the same one. So 2 key challenges in all of our studies, okay? The first was the statistical analyses, blah, 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 this is what we're going to do. Second key challenge is collection of data where we might have trouble, you know, getting EEG or you know, getting our subjects and so on, maybe it taking too long. So we said what we were going to do and we acknowledged the challenges. And you really only for each aim have to acknowledge 1 or 2. You know, you don't have to go through a full list. But what are the key challenges just to show your reviewers that you've thought about it? Okay. Timeline and benchmarks. Different ways of doing it. Sometimes it helps to put them with each aim. And sometimes what I've done is aim 1 and then in parentheses months 1 through 18. And then I also replicate that down in a timeline. But I sometimes put it in the text as well as in other places. Be explicit and realistic and traceable. So as you go through reading and writing your aims and then creating your timetable, make sure they match. Sometimes I've seen where they don't really match. And sometimes you'll look at the timetable and they don't make any sense. We are collecting subjects from, you know, we're going to do all our development in year 1. We're going to start collecting subjects in aim 2, which starts at the beginning of year 2. We're going to collect our subjects all the way through the end of year 4. We're going to start our analyses in year 3. Wait a minute, how can you do that? You don't have all your subjects. You know, so make sure your timeline really makes sense. Be explicit, again, realistic and traceable, and especially with benchmarks, because I've seen benchmarks that makes absolutely no sense. You know, we're going to improve accuracy by 25%. Wow, nothing in radiology has ever increased diagnostic accuracy by 25%. I mean, development of MR. I mean, you know, it just hasn't happened. CAD didn't do it. So be realistic and base it on your preliminary data. If your preliminary data increased the area under the curve from 0.85 to 0.87, don't tell me you're going to go up to 0.99. How the heck are you going to do that? You know, really? So be realistic, and does your preliminary data support it? Is it clinically realistic? Okay, all of this is fine on paper, and your little mathematical equations show this. But if I translate this into the clinic, is it really going to do that? And is it clinically significant? Okay, it might be statistically significant to increase performance by 2%. How many patients does that really impact? And oh, by the way, is it a clinically significant impact? Does it matter if I increase the diagnostic accuracy of defining a benign condition, but I do nothing to affect the malignant condition, and so on? What are the implications if it's not reached? Will not meeting the benchmark of aim 1 impact your ability to move on to aim 2? And again, that's where your potential pitfalls and things come into play as well. Different ways of doing a timeline. Here's one project where we actually explained in text what we were going to do. So you can do it in the text. Put the timeline, but have it all kind of verbal. You could do this, okay, showing year by year each aim and each task. And I, in parentheses, define what those tasks were to remind the reviewer, oh yeah, this is what we were doing. This is another type of timetable, okay, noting the years, what your benchmarks are. And instead of saying benchmark 1, benchmark 2, you would actually put in what your benchmarks are. So it always helps to put in something visual or some sort of timetable. The final paragraph of your approach, really of your entire proposal in a sense, and about one paragraph, is basically saying, what's your renewal going to look like? If you fund me, I don't want to just be funded for 4 years, because I'm coming back if we're successful. What are those next 4 years going to look like? Okay, so sum up where you expect to be at the end of the project. We expect to have, or we will have, is even better, and never throughout your proposal say we think, we might, we could, it, you know, don't ever be wishy-washy. Say we will. This project will. Okay, you're always just definite. Sum up where you expect to be. At the end of this project, we will have a prototype of our new system that's been validated on 10 subjects, 10 healthy normal subjects. Future directions, we will then package this to be, U.S., electrical safety, all this other stuff. And it will be then ready to go to a multi-institutional site. Oh, and by the way, we've already got 3 people who have said they'd love to collaborate with us and list them. And we are going to do a multi-institutional clinical validation study. You're convincing them that you're going to succeed and where you're going to go. And then what and why is important. This is especially important as a new investigator or early stage investigator, and especially if you're doing Ks, RO3s or R21s, because these are sort of the more exploratory. So yeah, we're getting exploratory. Where do we expect you to go? There is one exception. This is for a renewal. So if you happen to have gotten 4 years of funding, you do get to give a little progress report. Unfortunately, you have to fit it into those same pages. You don't get any more pages. But if it is a renewal, you're expected to say what you've done. What'd you do with the past 4 years? What'd you do with all that money we gave you? So you don't get any extra pages, but you want to have a statement of. This is a renewal of a project that began in 2004, lasted through 2008. We're picking up now. What were the existing aims? And especially if they got changed from the point when it was funded, because every now and then you'll get a grant and you have to change the aim simply because life changes from the time you wrote it. So if they did change, kind of restate the aims. Paragraph on what were your major aims, what were your discovered, what did you find? You do get, however, a separate PDF, not against your page limit, that lists every single product from your primary funding. So you would say in this progress report, please refer to Appendix A that shows all of our publications, all of our presentations, all of our patents, all of our IP, blah, 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 and in there you can refer to your websites. There is a prohibition in NIH grants that you're not supposed to refer to websites for sending the reviewers off for more detail. Okay, that's cheating, they say. And if you didn't make your progress, you might not be wanting to apply for a renewal. Sometimes a lot of the killer statements that come back for a renewal is they weren't very productive. They had 3 publications over 4 years? Sorry. So make sure if you're going to do a renewal that you actually made progress and you have something to show for it. Okay. So in a nutshell, that's kind of, the approach. And again, it's kind of an art to get it into 6 or 12 pages, but hopefully this kind of gives you an idea of, some of the ways to approach that. So any questions?